Every cold season, millions grab these boxes without a second thought. But how dangerous are these everyday decongestants, really? The answer may surprise you. I'm Dr. Elena Ross, a clinical pharmacologist. My job is to uncover the real risks hiding inside the medicines we trust without thinking twice. Decongestants come as pills, liquids, and nasal sprays. Each cold season, millions reach for them to clear a stuffy, blocked nose fast. Here's how they work. Decongestants shrink swollen blood vessels inside the nose, reducing inflammation so air flows freely and breathing becomes easy again. Meet Mark. Like millions of others, he reaches for his nasal spray daily, feeling instant relief. He's a typical long-term user. But look closer. His calendar shows day after day crossed off, far beyond the recommended limit. And that prolonged use is where real danger begins. There's a hidden trap called rhinitis medicamentosa, or rebound congestion. Overuse actually retrains your nasal passages to swell right back, worse than before. The cycle is deceptively simple. Congestion strikes, the spray brings relief, but as it fades, the swelling returns even stronger, demanding another dose. For Mark, relief grows shorter each time. His body now depends on the spray just to breathe, and the dependence quietly deepens with every use. And each new dose only feeds the very problem it promises to solve. The danger isn't only your nose. Decongestants are stimulants. That means real cardiovascular risks, tightening blood vessels and straining the heart over time. Inside the body, the effects intensify. The heart races faster, blood vessels constrict, and blood pressure climbs steadily toward dangerous territory. In vulnerable individuals, the stimulant effect can trigger cardiac arrhythmias, irregular heartbeats that, in serious cases, become genuinely dangerous. The stimulant properties don't stop at the heart. Many users, like Mark, find themselves wide awake at 3 a.m., restless, unable to quiet a racing mind. By morning, the toll shows. Anxiety and tremors set in, hands unsteady, nerves frayed, even a simple cup of coffee left untouched. But the risks extend even further. Dr. Ross turns to a subject too often overlooked: the danger of combining decongestants with other drugs. Certain combinations are especially hazardous. Decongestants can react violently with specific antidepressants, creating hidden risks most users never see coming. Combined with MAO inhibitors, decongestants can spike blood pressure to dangerous extremes, a serious, sometimes life-threatening interaction that demands real caution. Decongestants can also interfere with blood thinners, altering how these vital medications work and raising the risk of serious complications in unsuspecting patients. For those managing high blood pressure, decongestants can undermine their medication, sending readings climbing to dangerous, alarming levels. Not everyone faces equal danger. Those with pre-existing conditions carry the greatest risk, and for them, even a common decongestant demands real caution. Heart disease, high blood pressure, and thyroid disorders each transform a routine decongestant into a genuine and serious threat. There's another overlooked hazard. In people with glaucoma, decongestants can raise pressure inside the eye, quietly worsening a fragile condition. Eventually, the consequences catch up. Racing heartbeat, worsening congestion, sleepless nights. When warning signs like these appear, it's time to see a doctor. Mark, your chart confirms it. This is rebound congestion. The spray you trusted has been feeding the very problem it promised to fix. So the medicine made it worse? I had no idea. In that moment, understanding lands. The relief he chased was an illusion. The cure had quietly become the cause of his suffering. Here lies the trap. On store shelves, these products feel harmless, but over-the-counter never means consequence-free, and casual use carries real risk. The answers hide in the fine print. Available does not mean harmless. Every warning on that label exists for a reason. The protection you need is printed right here. Read the label. Follow the duration limit. These simple habits prevent the entire cycle we've explored. Remember this one rule. Do not use for more than 3 days. That single line is your safeguard against dependence. My strongest advice is simple. Before you reach for another dose, talk to your doctor or pharmacist. They can guide you towards safe, effective relief tailored to you. With guidance, Mark discovered smarter choices. Saline sprays, humidifiers, and simple habits offered lasting relief without the trap of dependence or the hidden dangers he never suspected. Gentle, drug-free remedies can ease congestion safely. A soothing saline rinse, warm steam inhalation, and a bedside humidifier all help you breathe easier, naturally. Weeks later, free of the cycle, Mark breathes clearly again. Rested and restored, he proves that recovery is possible once the dependence is broken. So here's the verdict. Rebound congestion, cardiovascular strain, and dangerous drug interactions. 3 real risks that turn a simple decongestant into something worth respecting. The truth is balanced. Decongestants offer real, welcome relief, but carry serious risks. Used wisely and briefly, they help. Misused, they harm. Respect the medicine. Here's your safe use checklist. Limit use to 3 days, know your existing conditions, and always ask a professional. Simple steps that keep relief from becoming risk. Before you buy, ask questions. A pharmacist can flag risks in seconds, tailoring advice to your health and your medications. Decongestants can help, but respect them. Stay informed, stay cautious, and you stay in control of your own health. Have you experienced rebound congestion? Share your story in the comments below. Your experience might help someone else break the cycle. For more trusted health investigations that keep you informed, subscribe and hit the notification bell so you never miss an episode. Medicine is a tool, not a shortcut. Use it wisely, and your body will thank you for years to come.